සැත්කම් සඳහා ස්ථාවර අවමගාස්තු දැන් නවලෝකෙන් අමතන්න 0.771
Latest study report on the spread of COVID-19 in Sri Lanka conducted by the Department of Immunology and Molecular Medicine of the University of Sri Lanka was handed over to the Ministry of Health today. The report concludes that the UK originating highly transmissible Alpha variant, which aggravated the third wave of the virus in the country, has now become the dominant variant, surpassing the common strain in Sri Lanka. According to the study, Director of the Department of Immunology and Molecular Medicine at the Sri Lanka University, Dr. Chandima Jeevandara says that biological samples obtained from COVID-19 patients reveal that this strain has extended its reach across the country. Accordingly, cases have been reported from Batiklo, Trincomalee, Kuliyapitiya, Variapula, Habaraduwa, Tissamaharama, Karapitiya and Ragama. Meanwhile, another patient infected with the Delta variant, which identifies the strain of Indian origin, has been detected from a quarantine centre in Vaskadua. He was later identified as an arrival from India. Meanwhile, Dr. Jeevandara offered clarification over the speculation that a Sri Lankan is at the centre of the recent Melbourne cluster.
ඒ ඔස්ට්‍රේලියාවේ වාර්තා වෙච්ච පුද්ගලයා ලංකාව තුළට පැමිණි පුද්ගලයෙක් නෙමෙයි ලංකාව හරහා අපි කියන ට්‍රාන්සිට් පැසෙන්ජර් කෙනෙක් විදිහට ගිය කෙනෙක් විතරයි ලංකාව තුළට කිසිම විටක ඇතුළත් වීමක් වෙලා නැහැ නිසා ලංකාව තුළ සමාජයෙන් හෝ කිසිම විටක වාර්තා වෙච්ච පුද්ගලයෙක් නෙමෙයි.
Meanwhile, health authorities yesterday confirmed the death of 67 people owing to the novel coronavirus. Among them, 19 people have perished during the period from the 17th to the 31st of May, while the rest have died between the 1st and the 8th of this month. 6 people among them have died at home, while 5 among them have succumbed to the virus while being hospitalized. In addition, a week and a day-old infant is also among the dead, making him the youngest to succumb to the virus in Sri Lanka. 2 youth at the ages of 21 and 29 have also perished due to the novel coronavirus. With that, the number of COVID-19 related deaths in Sri Lanka rose to 1,910.
There has been increasing number of deaths reported in the island. And we know that current increasing trend need to be curtailed, and the Ministry of Health has already started to address this issue by analyzing the deaths and then identifying the areas or points at which we can address the issue and then prevent the deaths or preventing the persons going into complications. And all these activities have been analyzed and recommendations are made by the specialists, have modified the relevant guidelines and others, and special instructions have been issued either to prevent such happening or to mitigate the things that will lead to the death of these people.
Meanwhile, 2,735 infected patients were detected across all the districts in the country yesterday. Gampaha recorded the highest number of new infections with 545, Colombo reported 543, while Kalutara confirmed 358 cases of infection. In the meantime, Wani district member of parliament representing the Sri Lanka Podujana Peramuna Kader Mastan has tested positive for COVID-19 following a rapid antigen test conducted before attending a meeting at the Prime Minister's office. On the vaccination front, 66,060 people were given the first dose of Sinopharm yesterday, while 6,828 were administered with the second dose of the same vaccine. Including the Covishield and the Sputnik vaccine so far, 2,089,320 people have received at least a single dose of the vaccine against COVID-19. In the meantime, based on 15 demands of non-medical services, the Health Services Trade Union Alliance decided to abstain from duty tomorrow from 7 a.m. till noon in protest of the Health Ministry's plan to increase allowances related to medical services by 78%. What's more, state and private banks island-wide was open today and will be open tomorrow as well for the payment of pensions. In addition, post offices have also been instructed to remain open on the 12th for this purpose. Pensioners who do not use the transportation services arranged by the government can use their pension card, national identity card or the SMS sent by the Pension Division of the Ministry of Public Administration as a travel pass. Taking into account the travel restrictions that are in place, the government arranged for transportation for pensioners. However, pensioners in some areas experience difficulties due to the lack of transportation services. Compared to the last few days, a reduction in the number of vehicles entering Colombo was witnessed today. However, a large number of vehicles were seen at certain entry points to Colombo. In the meantime, head of the National Operations Centre for the Prevention of COVID-19 outbreak, Army Commander General Shavendra Silva rubbished social media rumours that the travel restriction will be extended from 4 a.m. on the 14th. He assured that such a decision has not been taken yet.
වීව එකතුණු උකුතේ එකක
රස උපරිමයි.